Examination of the trigeminal nerve. The fifth cranial nerve is called trigeminal nerve and divides into 3 terminal branches. The ophthalmic division supplies the conjunctiva, except that of lower lid, lacrimal glands, medial part of the skin of the nose, upper eyelids, forehead, and scalp, as far as the vertex. The maxillary division supplies the cheek, front of temple, lower eyelid, and its conjunctiva, side of the nose, upper lip, upper teeth, mucous membrane of the nose, upper pharynx, roof of the mouth, soft palate, and tonsils. The mandibular division supplies sensations to the lower part of the face, the lower lip, ear, tongue, and lower teeth. The mandibular division gives motor supply to muscles of mastication, tensor tympani, tensor veli palatini, mylohyoid, and anterior belly of the digastric muscles. Assessment of the trigeminal nerve involves motor examination, sensory examination, and reflexes. Assessment of motor component of the trigeminal nerve. First, ask the patient to clench the teeth. Normally the masseters and temporalis on both sides stand out with equal prominence. If there is paralysis on one side, the muscles on that side do not become prominent. Then, ask the patient to open his or her mouth. Normally the jaw is central. If there is paralysis on one side, the jaw will deviate to that side, being pushed by the healthy lateral pterygoid muscle. Assessment of the sensory component of the trigeminal nerve. The sensory function is tested in all the 3 divisions separately, comparing both sides. Pain, temperature, and light touch are tested using a pin prick, ice cube, and cotton wisp, respectively. The patient's eyes should be shut. Take a piece of cotton, or the ball of your finger. Lightly touch either one or both sides of each of the 3 divisions of the trigeminal. Ask the patient to show or say whether you touched one or both sides of the face. Next, take a safety pin and gently prick first one side of each division, and then the other, asking the patient if there is any difference in the sensation on one side compared to the other. The sensation of temperature is tested similarly using an ice cube. Assessment of conjunctival and corneal reflexes. Ask the patient to turn his or her eyes in the opposite direction. Touch the cornea or conjunctiva from the side with a wisp of cotton. In response to this stimulus, normally there is blinking or closing of the same eye and the opposite eye. Assessment of the jaw jerk reflex. Place the index finger over the middle of the patient's chin, holding the mouth slightly open. Tap the finger with the hammer. The normal response is slight and consists of closure of the mouth. Significance of jaw jerk reflex. Since the normal response is slight, an absent jaw jerk is not always pathological. When abnormal, with upper motor neuron lesions, there is a hyperactive or repeating reflex. With nuclear or infranuclear lesions, the reflex is absent. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.